As the pandemic progresses in the U.S. and the number of cases rise, public health officials all across America seem to be becoming targets. Some are being threatened with violence by citizens who are disagreeing with their advice. The executive director of the Colorado Association of Local Public Health Officials says 80% of the 53 members she represents have reported threats from citizens. I'm joined by Theresa Anselmo now to talk more about that. Theresa, thank you for your time. It seems so disheartening that the people who are just out there trying to help other people not get this virus are becoming targets. Tell me a little bit about the nature of the threats.
Yes, it is very disheartening, and thank you for having me. Threats include anything from vandalism to buildings to personal property to a hot shooting civil war, as one of our health departments received a threat on Facebook of that nature. So,
wow.
Very wide range of different kinds of threats. And then political pressure, funding withdrawal, those types of things as well.
Is it because people do not believe in the way the local governments are handling the outbreaks?
Some of those threats came in even under the statewide orders that we were experiencing, and when local public health agencies and officials had to enforce those orders. So I think it's a broad range of issues, and I do believe that there is really a concern that this is an impingement or restriction of their individual rights, much along the continuum of freedom of speech and all of those types of things. So I think it's just very, very difficult time for the public health officials that, as you mentioned at the beginning, are really trying to do what's best for their communities.
There is no doubt in your mind that COVID-19 has been politicized in the United States?
There is no doubt in my mind.
And to what do you attribute that to, Theresa?
I think it's a number of different factors. I think that over recent years, we've seen a very big shift from disbelief of science and evidence. You can name a number of issues in which that comes into question. I do think that we see examples from the leadership at the federal level down about the dismissal of science, of experts, of the people that are put in these positions to advise those that make policies around economic issues and other things. And so I think it's really coming from the top down in the United States.
I have 30 seconds left. What can your health workers do when they're confronted by sort of this resistance?
You know, I think what they've done is a number of things. If it's a true threat of violence, they have reported it. I think they continue to try to do the work that they have gotten into public health to do, which is to protect the people that are the citizens and the residents of the communities they serve.
Well, we wish you the very best and good luck moving forward. Thank you for sharing your experience with us. Theresa Anselmo is the executive director of the Colorado Association of Local Public Health Officials.